Begin with the latest developments coming in on the COVID-19 vaccine, as AstraZeneca has said that its COVID-19 vaccine candidate has shown an average efficiency of 70%. The vaccine candidate has been developed along with the University of Oxford. One dosing regimen showed vaccine efficacy of 90% when given as half a dose, followed by a full dose a few weeks later. Another dosing regimen showed 62% efficacy when given as 2 full doses at least 1 month apart. Now, the combined analysis from both dosing regimens resulted in an average efficacy of 70%. Even though the AstraZeneca's vaccine candidate shows low efficacy than Moderna and Pfizer's candidates, it has its own advantages. The vaccine candidate is said to be cheaper and easier to store. Reports also say that it can be transported to every corner of the world. The UK government has already ordered 100 million doses of Oxford vaccine candidate. This would be enough for a population of 50 million people. This particular vaccine candidate is a genetically modified common cold virus that used to infect chimpanzees. It has been altered to carry the spike protein. When a human body will be injected with the vaccine candidate, it will start producing coronavirus spike protein. The immune system will consider it as a threat and fight against it. When the immune system comes in contact with the real virus, it will be prepared. And so UK's Prime Minister Boris Johnson has hailed the AstraZeneca vaccine candidate breakthrough, calling it fantastic, but says checks are needed. For more details, let's quickly go across to our London Bureau Chief Mandy Clark, who's bringing us a ground report from London. Mandy, what are the findings of this trial and how soon can UK expect them to be delivered?
Well, the challenge now is really mass producing it. They are promising within a few short weeks, around 5 weeks, which is an incredibly short period of time. Of course, those checks have to happen. Even AstraZeneca said it's fantastic news, but it needs to be peer-reviewed just to make sure it crosses every T. But it does seem like weeks, not months, which is exactly really what the world needs. And to go further to what you indicated, it's really the fact that this is easier to store, easier to transport. And they made it clear this wasn't just an Oxford effort, this was a global effort with global partners. So it seems like a cure that was made for the world to be sent to the world.
Right. Mandy, now many experts are comparing the Oxford AstraZeneca vaccine result of 70% efficacy to that of Moderna and Pfizer, both of which have produced 95% protection from COVID. In that sense, where does the Oxford trial stand in comparison to these vaccines?
Well, it's kind of, yes, one is more effective than the other at the minute, but it's difficult to store. And that is the main concern about the Pfizer one. This one's easier to store, less efficacy. Of course, they say it increases the efficacy if you do it at jabs 3 weeks apart. It is not a competition between two vaccines. It's finding many solutions for many people. So in ways, it shouldn't be seen as one against the other. They should be seen as many solutions for a global problem. So more vaccines that can produce results, the better it is for the world. But the main difference, as you posed, is one has higher efficacy, but it is just that harder to transport, harder to store those vaccines. The other one has a slightly reduced one, but it is easier to transport and to store.
It's interesting that you've mentioned the advantage when it comes to storage. Will the cheaper cost of the Oxford vaccine also give it an edge over Moderna and Pfizer?
Perhaps it can. Really, we're in the early stages. We're not sure. Maybe the Pfizer vaccine can find a way to make it easier. The big rush was finding the solution to unlock that vaccine. Now this is figuring out how to do that storage. But yes, it might mean that it might be a more global solution for areas that don't have, perpetual refrigeration and storage. There are areas in the world that will need a more easily transportable vaccine. So it's just offering more solutions to more people.
More solutions to more people. That's a good way of putting it. Thank you so much, Mandy, for bringing us all those inputs.